I'm Avi Singh. I'm the Associate Program Director at Northeast Georgia Family Medicine Residency. My role is to sort of oversee day-to-day responsibilities at the hospital for the inpatient team, make sure everything is running smoothly, from each workflow of putting orders in to making sure admissions are happening smoothly. I kind of oversee all the workflows and make sure that it happens in the way it's supposed to happen. We also have a inpatient committee, which is formed by residents from each class that kind of contributes on what you're doing while you're on inpatient. So things that might need improvement, we all sort of come together and work on these workflows together and then go from there. Next year, we're really excited about launching our longitudinal learning curriculum that will sort of rotate through the year and give everyone an experience to go through the topics so that everyone is getting a similar educational level beyond just from the clinical cases that they're seeing. And I think that we're really excited about that. We're also very excited about having sort of a larger team. So we'll have 3 interns with a second year and a third year. So a full complement of residents that will really support the inpatient team. So there will be a lot of supervising by the senior residents and the attendings, and I think that will help a lot of the residents grow in the trajectory that we're hoping them to grow. So we're very fortunate to have a very large level 1 trauma hospital here in Hall County. We serve 19 counties around our area and tend to see patients from sort of, everywhere. So you get to see people from the mountains who have not received a lot of care and don't have a lot of care out there coming here as a tertiary care center for emergencies, and then people who are in our community who also need care. Once our new tower is built, we'll have over more than 700 beds for inpatient care, so that's a lot. We have pretty much every specialty that you can imagine under the roof, from gastroenterology to cardiology. So you will get to interact with a lot of specialists and get to learn a lot about, not just basic inpatient care, but also how all these specialties interact with when you're on your hospitalist service. I think one of the big things to take away is that with this large population and the complexity and the care that we have here, you tend to get good pathology. So your learning overall continues to grow, and you get to see something new pretty much every time you're on a rotation. So you'll get your bread and butter medicine, but you'll also get, a large scope of care that you may get in a larger hospital. During your 3 years, our inpatient experience is supposed to be longitudinal, so you sort of spend a little bit of time each year when you're in residency on your inpatient month. So the split right now for our PGY 1 year, you do 2 months of inpatient days and 1 month of inpatient nights. In your second year, you do 1 month of inpatient days, and then third year, you have 1 month of inpatient days and 1 month of inpatient nights. The goal is that the interns will carry about 5 patients each. Our service caps off at about 15 patients, and we do see some of our clinic continuity patients as well on our list. So it's sort of care throughout that we are hoping to grow at our residency. So you'll see patients and we'll sometimes directly admit them to the hospital or take care of patients who have gone to the emergency room from our clinic. So we're very fortunate to do that. Our faculty members who precept our inpatient side of things, so I tend to precept 1 week of the month, but then the rest of the faculty tends to rotate off the rotation. We have family medicine, our own attendings as part of faculty on the inpatient side, so you always sort of have that relationship of knowing that your faculty will be coming on and working with you while you're on your inpatient rotation. The growth that happens on inpatient tends to be longitudinal also, so the expectation to carry patients and carry patient loads increases over time. So obviously as an intern you start slower, and then that gives you time to get used to the hospital, the EMR, and everything else that kind of rotates around with being a doctor. So that's sort of our flow. I think our approach is very much, we want to make sure that you're getting the education that you want to get. You've spent a lot of time in medical school, kind of tailoring the experience that you want to get. Family medicine is one of those specialties that there is so much to do and so much to learn from, and to do it in a small amount of 3 years is difficult. So we want to make sure that you're getting what you want in the next 3 years while you're here. We have plenty of electives designed and a lot of specialists available that will kind of help you grow into the role that you want to grow into. So that is sort of our goal.